The bacteria that we are focusing on today is Vibrio cholerae. It is associated with the epidemics that was caused by cholera. This is the only bacteria in this genus that causes these epidemics. It is a gram-negative bacteria that is facultatively anaerobic, and if it is gram-stained, it will show up pink. This particular bacteria requires sodium chloride to maintain growth and function. And with these pandemics causes a dense history of this bacteria. For many years, people did not treat their feces and threw them into the street. It is known that 7 to 14 days later that this cholera-causing bacteria is still found in the feces. However, many people contracted the cholera infection by non-treated drinking water. It requires roughly 1 million bacteria to come down with the cholera infection. From 1817 to 1917, roughly 40 million people died from this infection. These countries included India, South America, the Caribbean, and Europe. But such great deaths inspired many wonderful books. The Nobel Prize-winning Love and Atomic Cholera is about a true love that happens in Colombia. It is not full of scientific references, but is a great book to read. And with books associated with them comes movies, and there are two great movies that reflect this particular bacteria. Horseman on the Roof was made in 1985, however, a more recent movie was Painted Veil. It's about a doctor trying to treat this epidemic and his love at the time. I highly recommend this movie because it has Naomi Watts in it. So, what happens when you contract cholera? Well, there are many symptoms associated with this particular bacterial toxin. Some of the symptoms most severe are the pain associated with the rectum or the abdomen. Other symptoms are severe diarrhea, watery diarrhea, and severe vomiting. However, what gets the most people are the dehydration and will cause most death. Also, nausea, fever, and hunger are associated. And then there are even more symptoms associated with cholera. They include leg cramps, dry mouth, fast beating heart, and weight loss. There are many treatments that help aid in getting rid of this cholera toxin. The most important thing you do is replace the fluids and electrolytes lost when you have this bacteria. One of the best ways to replace the electrolytes and fluids is with an ORS. This can be found in a powder or liquid form. 1/2 of the people who do not rehydrate will die, or only 1% of the people who do will die. Even though antibiotics are not associated with treatment of this, it can be used as an aid to help the symptoms. In many research studies, zinc is also a
Cholera toxin, an AB-type enterotoxin produced by Vibrio cholerae, causes cholera. Cholera often enters the body through ingestion of contaminated food or water. Between 1 million to 100 million Vibrio cholerae must enter a host to become infected. The contaminated water travels from the mouth down to the esophagus into the stomach. A lot of the bacterium die from acid in the stomach. However, some survive and travel into the small intestine and attach to the epithelial cells. The B subunit of the cholera toxin attaches to the GM1 ganglioside receptors and enters the cell through endocytosis. The cholera toxin then goes into the Golgi body and into the ER. The A subunit now activates adenylyl cyclase. This molecule is a cyclic nucleotide that mediates several regulatory systems in the cell, including ion balance. So the ion pump secretes more ions faster than it can absorb ions from the small intestine epithelial cells into the intestinal lumen. This causes buildup of fluid into the body, leading to secretion of watery stool, which contains cholera bacteria, bicarbonates, and other ions.